Toutle Lake Community Heart Project, Melissa Nusbaum, Nursing 541 Population Project, University of Arizona. Hello, my name is Melissa Nusbaum. I'm a registered nurse at St. John Medical Center in Longview, Washington. I live in a very small community 35 minutes northeast of Longview. It is the last stop before Mount St. Helens, with many fishing, hunting, and camping opportunities, as well as hiking and floating down the river. Our community consists of a volunteer fire department, a tiny little post office, a school that houses K through 12 on the same campus, where Friday Night Lights is alive and well, and the general grocery store is the hub of all who live and pass through our town. We are Toutle. Toutle is home to approximately 2,300 people. However, it is estimated that over 500,000 people visit Mount St. Helens each year, in addition to the many more that come to hunt and fish and recreate in our community. That is a tremendous amount of traffic, which helps sustain our small town. However, it is also a burden. As stated previously, our fire department and EMS responders are solely volunteer. Additionally, the ambulance dispatched from the station can respond and treat on site, but cannot transport due to insurance reasons. Therefore, if there is a need to seek further care, another ambulance from the nearest town and/or lifeline is then called to respond. Without accounting for assessing and stabilizing a patient, the drive time alone from the time of the crisis to the nearest hospital is just over an hour. So realistically, it could be as much as 2 before treatment is underway. Given this disparity, I would like to educate and train our community to perform CPR to help the survival rates of those having a cardiac event in our community. Additionally, given the amount of traffic and the distance to the nearest hospital, an AED needs to be present in the local general store. A sudden cardiac event is 88% more likely to happen away from a hospital setting, meaning in your home, out in your community, out in your travels. We live in a world that is always in motion, always moving fast. However, during an event such as this, every single second counts. The clock is ticking. Your blood isn't circulating, your tissues and organs aren't getting oxygen, and the likelihood of death is becoming more of a reality. Some statistical information regarding a cardiac event. As earlier stated, 88% happen outside the hospital setting. Most victims show no signs of ailment and many seem in good health, and sadly only 8% survive. According to the American Heart Association, quote, "The only way to survive, period, is by immediate CPR and being treated quickly with defibrillators. To be effective, this treatment must be delivered quickly, ideally within 3 to 5 minutes after collapse." End quote. For this reason, it is extremely important that a bystander or layperson in the vicinity begin CPR, especially in a community, an area where EMS is completely volunteer and the initial drive time to the victim alone is greater than 5 minutes, not to mention the transport time of obtaining greater interventions and care. Healthy People 2010 and 2020 have outlined goals related to health disparities for specific populations. One of the goals listed is to, quote, "increase the quality, availability, and effectiveness of educational and community-based programs designed to prevent disease and injury, improve health, and enhance quality of life," end quote. The intervention of the community-wide CPR program is in line with this goal and the objectives of preventing disease and injury, improving health, and enhancing quality of life. Additionally, in terms of a nursing diagnosis, at the very least, the Toutle community is at risk for anxiety, secondary to the deficit of knowledge, as well as the readiness for enhanced learning. Additionally, the Toutle Lake community is at risk for a few other nursing diagnoses. Risk for education deficit, secondary to increased time down in the field, as evidenced by the lack of local EMS transport. And at the heart of it, risk for decreased cardiac output, secondary to education deficit, as evidenced by, again, lack of local EMS transport. The proposed interventions for the potential vulnerability of this population are twofold. First, 4-week community-wide CPR classes that involve 6 sessions to introduce the basics of why CPR is important, teach how to perform it, and give adequate practice time, with the first being taught by a certified CPR instructor and the subsequent classes being taught by qualified community liaisons. This would be free to whomever wanted to attend. The idea behind the multiple classes is to A, accommodate the differing schedules and busy lives of our community, but also, as according to the AEDchallenge.org, the number one reason CPR is not initiated by bystanders in a cardiac event is simply due to knowledge, understanding, and fear. Therefore, this program would give participants multiple opportunities to learn about and become comfortable with the process. This would include current CPR guidelines of compression-only bystander training, as well as giving breaths and the reasoning behind both. As healthcare professionals, we are aware that CPR increases the chance of surviving a sudden cardiac event. However, only 32% of those who experience this outside a hospital setting will receive it. As already stated, only 8% survive, but without CPR, none of them survive. So to get an entire community comfortable enough to start the process during a stressful circumstance will take multiple sessions. Additionally, I propose adding an annual refresher class to keep the community fresh in their skills, to educate on any new guidelines, answer questions, and to encourage more people to become involved. The second part of the intervention is simply to have an AED at Drew's or the local general store, as it is truly the hub of the community and where thousands of people stop annually. This would include a brief training session for the employees so that they too will feel ready to administer potentially life-saving care in the event of a cardiac crisis. The obstacles of a community-wide event are simply stated: time, funding, and space. Additionally, tailoring a course to accommodate all education levels may be difficult as well, but incredibly necessary. To confront some of these barriers, first, funding needs to be addressed. The American Red Cross estimates the cost of teaching a non-certification class at $15 per person when those candidates are coming to them. The cost of bringing the equipment and instructors to the site would be substantially more. If the CPR training is for certification, the cost increases by 5 times per person to $75. As the goal is to make this free to the community, those costs would need to be absorbed and included in the grant, as well as the funding for the proposed AED. Space for such an event would not be an issue for this community project. Depending on the number of participants, the local school district has offered either the multipurpose room that holds up to 232 or the high school gym that is able to accommodate a much larger number. The purpose of this project is not only to educate this community on the mechanics and the whys of CPR, but also to become more comfortable with the process, so in a crisis such as a sudden cardiac event, there is clarity on what to do and CPR is thusly initiated. Therefore, time becomes an important component of this project. The participants need to be able to practice and ask any questions that may arise, as well as give ample opportunity to include all community members with their busy schedules. This is where myself and 3 other registered nurses come into play. We all live here and have a vested interest in the success of this program. We will offer 5 additional training days or evenings starting 1 week post to the initial session to coach, answer questions, and to give the program familiar faces, which is incredibly important to a tight-knit community such as ours. In looking at a logic model for this project, the goal is to increase the use of CPR in a sudden cardiac event. The proposed activity: provide and educate the community-wide CPR classes. Process: 6 consecutive classes, 1 week apart, teaching CPR reasoning and mechanics. Outcome measures for this program will be difficult to measure in real time. However, an immediate measure of success will be the number of attending participants and certifications. And any of the external factors that may hinder funding, time, and the education levels of the participants as discussed in the previous slide. As previously mentioned, evaluating the success of this program may not be seen immediately, as these types of events are very random. However, given the enormous disparity our community faces with every healthcare crisis requiring an EMS transport, giving even a single person the knowledge of how and when to start compressions could likely be the difference between life and death. Therefore, this intervention is truly immeasurable. As stated several times throughout this PowerPoint, 88% of sudden cardiac events happen away from the hospital setting. And although the survival rate is grim in terms of real numbers, even when CPR is initiated, not starting compressions at all means certain death. Therefore, for the purpose of having this evaluation, it would have to come in the form of community participation. In summary, the proposed program addresses a very real disparity and barrier to surviving a sudden cardiac event in our community. Using American Heart Association guidelines and having the initial class be given by a certified CPR instructor provided by the American Red Cross, this community program would include 5 additional hands-on informative classes given over the course of 4 weeks. This would allow maximum opportunity for education and familiarity with the CPR, what CPR is and why it is important, and as stated earlier, the mechanics of physically performing it. Additionally, an annual refresher course should be offered. And as stated, the second part of this intervention is the introduction of and education about the AED in the general store. It is a large undertaking, but giving people the tools to help themselves in times of crisis empowers that community to survive. Thank you. References: Best Place to Live in Silver Lake, Sterling's Best Place to Live. CPR Statistics 2015, American Heart Association. Educational and Community-Based Programs 2015, healthypeople.gov. Get Trained and Certified 2015, American Red Cross. Mount St. Helens National Park 2015, mountsthelens.com Informational Center. Why are bystanders CPR rates so low? 2015 AED Challenge.